My name is Niyamatullah, Group 27, Semester 4. Chemotherapy. Chemotherapy is the use of antineoplastic drugs to promote tumor cell destruction by interfering with cellular function and reproduction. It includes the use of various chemotherapeutic agents and hormones. Principles of chemotherapy administration. The intent of chemotherapy is to destroy as many tumor cells as possible with minimal effect on healthy cells. Cancer cells depend on same mechanism for cell division that are found in normal cells. Damage to those mechanisms lead to cell death. Chemotherapy is utilized in different clinical settings as induction chemotherapy for advanced disease, primary treatment for patients who present with advanced cancer for which no alternative treatment exists, as an adjuvant to local methods of treatment. Adjuvant chemotherapy is the use of systematic treatment after the primary tumor has been controlled by surgery or radiation therapy to palliate symptoms of metastatic disease or prolonged survival. Chemotherapeutic agents can be effective on one of the 4 phases of the cell cycle or during any phase of the cell cycle. 4 stages of cell cycle, that is G1, GAP1 phase, ribonucleic acid, RNA, and protein synthesis enzymes of DNA synthesis are manufactured. S, synthesis phase. During a long time period, the DNA component doubles for the chromosomes in preparation for cell division. G2, that is GAP2 phase. This is a short time period protein and RNA synthesis occurs and the meiotic spindle apparatus is formed. M, that is the mitosis phase. In an extremely short time period, the cell actually divides into 2 identical daughter cells. Cells not active in the cell cycle are designated as resting. G0. Cells in the phase are one of the most part refractory to chemotherapy. Therapeutic strategies. Adjuvant therapy given to patients who have no evidence of residual disease but who are at high risk of relapse. The justifications of adjuvant chemotherapy are the high recurrence rate after surgery for apparently localized tumors, the inability to identify cured patients at the time of surgery, and failure of therapy to cure these patients after recurrence of the disease. Neoadjuvant therapy, preoperative chemotherapy administered prior to surgery in an attempt to downstage the primary tumor so the less invasive surgery can be performed. For example, patients with large breast tumors can preserve the breast and undergo lumpectomy instead of mastectomy. The goal of therapy is to decrease the amount of tissue that needs to be removed as well as the attempt to maximize cure potential. Neoadjuvant therapy, preoperative chemotherapy, as it's already said in the previous page, and the neoadjuvant therapy, high dose / intensive therapy. Administration of high doses of chemotherapy, usually in association with growth factor support or before bone marrow transplant / stem cell rescue, or dose intensification has received increasing emphasis in the recent years as a strategy for overcoming resistance to chemotherapy. Malignant cells may be resistant to certain drugs from the start of therapy, that is natural resistance, or become resistant after therapy has begun, acquired resistance. The dose intensification suggests that chemotherapy should be given in the highest tolerated dose over the briefest interval with the growth factor support. This has been tested in breast cancer and results show that it is more effective than standard treatment schedules and is easily and equally tolerated. It continues to be tested with other malignancies with unknown results. Routes of administration: oral, that is capsule, tablet, or liquid, IV, push, bolus, or infusion over a specified time period, intramuscular, intratracheal, intraveicular, given by the injection via an Ommia reservoir or by lumbar puncture. The intraatrial, intracavitary, such as the peritoneal cavity, intravesical into the uterus or bladder, topical, and dosage is based on the surface area, that is mg/m square, in both adults and children. Most chemotherapeutic agents have dose-limiting toxicities that require nursing interventions. Chemotherapy predictably suggests normal, rapidly growing cells, that is, bone marrow, GI tract lining, hair follicles. It is imperative that these toxicities be recognized early on by the nurse. Thank you.